which is bringing blood back. So this is the IVC, which is bringing blood back to the right atrium from the rest of the body except the heart, and then the coronary sinus that is bringing blood back from the heart itself, the heart tissue itself. Now this blood that reaches the right atrium is very deoxygenated. So the carbon dioxide levels are really high, CO2 levels are high, oxygen levels are low. The blood that comes from the superior vena cava and inferior vena cava is then mixed with the blood coming back from the heart as well and becomes even more deoxygenated. That deoxygenated blood then falls into the right ventricle. Through what valve? This will be the tricuspid valve or right atrioventricular valve. So right, this valve here is the right AV valve, or also called tricuspid valve. Blood from here then, when the right ventricle contracts, the blood will be coming out of the right ventricle through the pulmonary artery because it is taking the blood out, to the pulmonary artery to the lungs. So that completes. So I'm going to mark this blood vessel as the pulmonary artery. So that is the right heart and the left heart. If we look at this circuit, in a circuit diagram, it becomes a little bit more clear. So if you see here, the first thing to understand is heart has two pumps, right and left pump. These pumps are connected with two tissues in series. In series, I said, not parallel. The two tissues are lungs and the rest of the body. Lungs are actually connected to the rest of the body in series. What that means is this: the flow of the blood through the lungs is equal to the flow of the blood through the rest of the body. That is a very important thing. Now, the left heart receives blood from lungs and pumps blood to the body or the systemic tissue. Right heart receives blood from the systemic tissue and pumps blood to the lungs. So this is the serial circuit. I would ask you to draw it to understand it. Also, now look at the body. The body tissues itself, the systemic tissues themselves, are now connected in parallel. What that means is that cerebral, coronary, splanchnic, renal, skeletal muscle and skin, they do not receive blood like this. It's not that cerebral tissue got the blood from here, the blood will then go to skin, from there the blood would go to GIT, from there the blood would go to the kidneys. That is terrible. In this one, maybe after 2 or 3rd viscera, the next visceras are going to become deoxygenated, going to receive the deoxygenated blood and start having a problem. So this is not going to work. So systemic tissues, I'm going to put this here so you don't think it's a correct thing. The systemic tissues are connected in parallel. Only the body and lungs are connected in series. So make this very, very clear to you. Alright, so after this, hopefully this is clear. What we understand here is chambers of the heart, valves of the heart, the series circuit, the parallel circuit, and the direction of the blood flow and the chemical composition. Let's talk about the pressures, guys. So the pressures are really important from a couple of reasons here. One, some of these pressures are part of the vital signs. What are the vital signs? The vital signs are, we have the blood pressure, which is systolic and diastolic blood pressure, body temperature, heart rate, breathing rate, and oxygen saturation. I actually think that the pulse pressure should also be part of the vital signs because it is really easy to calculate or derive. So let's talk about the definitions of these pressures. Systolic blood pressure. So definition of systole. Systole is the time interval during which a ventricle is contracting. That is the definition of a systole. Systolic blood pressure, if you come here, systolic blood pressure is the blood pressure in systemic arteries when left ventricle is contracting. It is the blood pressure in systemic arteries when the left ventricle is contracting. That is the definition. Normal average systole in healthy individual adults is 120 millimeter of mercury. So that is a systolic blood pressure. Diastole, the definition of diastole is the time interval during which a ventricle is relaxing and is of course filling with blood. Now diastolic pressure is the blood pressure in systemic arteries during the relaxation of left ventricle. So diastolic blood pressure is the blood pressure in the systemic arteries, measured in the systemic artery or from the systemic arteries during the relaxation of the left ventricle. And normal healthy adult individuals have 80 millimeter of mercury as the diastolic blood pressure. Now pulse pressure. Pulse pressure is the difference between the systolic and diastolic pressure, or it is the delta P, it is the differentials between them. So that means pressure systolic minus pressure diastolic. That is why I said it is easy to calculate. So let's say 120 millimeter of mercury minus 80 millimeter of mercury equals 40 millimeter of mercury is the pulse pressure. So what that says to us is, it says that it is the difference if this is the diastolic blood pressure 80 and this is the systolic blood pressure 120, it tells us the difference between them. Why is that important? We'll see that in detail at some other point, but just to give you some clinical significance of this, if the pulse pressure becomes narrowed, meaning let's say the blood pressure of the person has dropped from 120 to 110, then the pulse pressure is going to be now 110 minus 80, which is, instead of 40, it is 30. Of course, that is now telling you something. 30 is telling you that there is something that happened and the two pressures have come near each other. Pressures can come near each other when there is blood loss. Pressures can come near each other when the left ventricle contracted and pushed the blood out. So that would create the diastolic blood pressure. But when the blood is now pumping, when the ventricle pushes the blood out, that is systolic blood pressure. And imagine if the blood fell back in the ventricle. That is, imagine if the aortic valve has a regurg, aortic valve is damaged and the blood fell back into the left ventricle, then what would happen? Immediately the pressure would go down. So that would be the narrowing of the pulse. On the other hand, it is also possible, for example, if somebody is doing an exercise, what happens during the exercise is, look here, it's very interesting. During the exercise, the systemic, arterial or vascular beds open up. So in the systemic, so what happens is during the exercise, the systemic blood vascular channels have opened up. That reduces the diastolic pressure. At the same time, the heart has started pumping with more force. That has increased the stroke volume. So when the stroke volume is increased, systolic pressure would go up, and when the vascular resistance is reduced, the diastolic would go down. So what would that mean? So let's say diastolic has gone down to 70 and the systolic has gone up to, let's say, 140. Now what is the pulse pressure between them? 70 millimeter Hg of mercury, right? So pulse pressure widening, that means it becomes bigger, or narrowing has a very important meaning, and one should always, as a doctor, as a nurse, one should always make sure that you understand what is the pulse pressure, and if it sounds abnormal, then we need to figure out and research why that is happening. Normally atherosclerosis, anemia, fever, and many such blood loss, many such things can cause pulse pressure to vary. All right, let's talk about the mean arterial pressure. Mean arterial pressure here, or MAP, the formula is cardiac output multiplied by systemic vascular resistance plus central venous pressure. Now, central venous pressure is usually negligible, so we can ignore it. That means mean arterial pressure mostly depends upon the cardiac output and the systemic venous vascular resistance. Usually it is difficult in a clinical setting to just go out and figure out what is the cardiac output and the systemic vascular resistance. So what happens is we have a rough formula that we can use to at least assess the mean arterial pressure. The significance of the mean arterial pressure is this, that it tells you as a doctor the perfusion pressure, and the perfusion pressure is the pressure necessary to bring blood supply to the systemic tissues for their nutritional needs. Normally, if mean arterial pressure falls below 60, then you as a doctor should be concerned. So what if you're sitting in the clinical, in your clinic, or you are in the hospital, and you have the only thing you got is the systolic and diastolic pressure. Can you assess the mean arterial pressure to understand if the perfusion pressure is okay in that patient? So yes, you can. So here is the formula: pressure of the diastole or diastolic pressure plus 1/3 of the difference between systolic and diastolic pressure. So how would we get this difference? We'll take pressure systole minus pressure diastole or diastolic pressure. So if we use that for this healthy individual, we'll say this: 80, that is the diastolic pressure, plus 1/3 of the difference between systolic and diastolic. What is the difference between them? 120 minus 80. So that makes it 80 plus, this would be 40. I'll put 40 here. So this would be 80 plus 40 by 3. 40 by 3 is roughly 13.3. So I'm going to say it 80 plus 13 is 93 millimeter of mercury. That is a mean arterial pressure. So you can assess it. When this pressure goes below 60, you as a doctor must be concerned, because a perfusion pressure of below 60 means patient is not going to get enough perfusion to perfuse their systemic tissues. So again, mean arterial pressure can be used in lieu instead of the systemic pressure. It's a little bit more precise to understand the perfusion pressure is okay as well or not. So thank you very much. Perfusion pressure is really just the mean arterial pressure.